Hi, this is Britt Dahlbeck, and this is my video blog for Counseling 521, looking at ethics this week. I chose to explore the ACA, which is the American Counseling Association Code of Ethics, and something that I was really pleasantly surprised to find this week was under section E.5, the diagnosis of mental disorders, was where in E.5.c they specifically talk about historical and social prejudices in diagnosis of pathology. This is separate from the cultural sensitivity piece, and I think it really adds to the information and the guidance that the ACA gives counselors. It says that counselors should ensure that they recognize the historical and social prejudices that could lead to a misdiagnosis or pathologizing certain groups or individuals, or just pathologizing symptomology that would be native to a certain culture and be accepted and not be pathology at all. So I just thought this was really important. Another piece that is separate from the cultural sensitivity to really give more guidance to a counselor. Some information that I felt was missing as I looked at the ACA was where it was talking about the informed consent in assessment. In the section of E.3.b, the recipients of results, this talks about that counselors would consider who is actually going to be looking at these assessments and who receives the results. Something that I really would like to see added or more information would be groups that would have limits on the confidentiality piece. And one of those groups would be the military. And I think it would be really nice if the ACA gave more information to counselors and gave more guidance in that regard. Military members have limited confidentiality in both their medical and in their mental health records. So their records are actually able to be seen by chains of command, which would also have people who are not medical or mental health providers. So they can have career impacts to their careers and their livelihoods by having assessments or diagnoses in these records. So I think it's really important for counselors to understand that piece if they're going to be working with the military community. There was a study done by Garahamlo, Holloway et al. In 2018 that talks about the military career impacts of mental health treatment. And it says 21% of service members have experienced a negative impact on their careers as a result of seeking mental health treatment. So I think this speaks of the gravity of assessment and diagnosis. And also something that counselors may not be aware of is that service members can be considered unfit to serve. And there are certain mental disorders which fall under that category that would make a person unfit to serve. And those include schizophrenia, bipolar 1 and 2, and severe mood disorders, including severe depression and anxiety disorders. So I think it's really important for counselors to understand that there is a gravity to the assessments and to the diagnosis that they would be giving a service member. It could affect their career as well as their livelihood. And I think if the ACA could give more guidance, that would be very helpful to counselors. Thanks so much.